Okay, so in order to do the blood pressure, the first thing that you want to do is make sure that the machine is plugged in. So you can see it's plugged into the outlet here, so we're all good to go. And the next thing you want to do is make sure that you have the right size blood pressure cuff. So in order to do that, you'll take the cuff. This is usually the standard one. You use it on most of your participants. And if you look here on this side, it says select smaller cuff, and on this side, it says select larger cuff. So basically what you're looking for is when you wrap this around your patient's arm, you want this side to fall somewhere between this line and this line, so somewhere like here. And if it doesn't, you'll just follow the instructions based on where it lands. So if it lands here and it says select smaller cuff, you'll use the small adult cuff, which is this blue one right here. And then if it lands on this side, you'll select the larger cuff, which is the large adult cuff. In this room, it's this black cuff. In some other rooms, they're red. It's labeled right there, large adult, so that's how you'll know which one to use. So for Rosie, we'll just use this one. Okay. So the first thing that you want to do once you're ready to measure the blood pressure is ask them if they want to take off their jacket. It makes your life a lot easier if you're not having to measure it over their clothing. So Rosie, do you feel comfortable taking your jacket off?
Yes.
Okay, perfect. If they have long sleeves, you can ask them to push it up. If it doesn't work, or if they don't want to, that's okay. It'll just make your life a little easier if you're able to have them take their jacket off or push up their sleeve. So in order to put this on their arm, you're going to measure right here. So where it says artery mark, you're going to line that up with their brachial artery. So their brachial artery goes right down the inside of their arm right here. So I'll go ahead and line that up and then wrap it right around. And you want it to be nice and snug, but not too tight where their circulation's being cut off or anything. And then the next thing you want to do is turn on the machine. So go ahead and do that. And you know it's on because it'll light up right here. And then before you start, you just want to tell your participant to keep their feet flat on the floor, relax their arm, and if they're talking, just have them stop and then let them know to stop talking, and then we can continue the conversation after they're done with the blood pressure. So in order to start, you'll just press this button right here. It says start or stop. So for this, you'll want to start it. So you'll just press it and then it'll start measuring. That usually takes a couple seconds. So while you're doing that, if you have to set up anything else for the intake, you're welcome to do that. Okay, so her blood pressure is 109/63. So when you're putting it into the red cap system, the top number is the systolic and the bottom number is the diastolic. And you're also going to have to put in the pulse, and that is the third number that's at the bottom. So her pulse is 62.